work or head work, we prefer to do it in an upright position because your head has a bunch of hollow cavities, okay? And if you did receive some kind of injury to your head, we want to see if there's any type of fluid levels caused by those injuries. You can't see it when you're laying down. Same concept when you are doing an upright chest x-ray versus a supine chest x-ray. You can't see the air and fluid levels. This is the best way to determine whether there is any internal injury to the skull. But there will be times where you get a patient from the ER and they're all completely gorked out, okay? They may be unconscious, they may not be able to follow your commands, and now it's harder to do it in upright, so we'll do it in a recumbent position. So you have to assess your situation at that time. The KV that we use is anywhere between 75 to 85. It is medium. Although it looks like there's a lot of hard bone up here, there are a lot of cavities. So we don't use very high KV. So it's going to be medium KV of 75 to 85. Most skull studies are done at 40 inches. Small focal spot, why?
Because fine detail.
Okay, we want detail. Short exposure times, why?
Because it's small.
You got a head injury. You're going to be able to hold still for the patient. I mean, is the patient going to be able to hold still for you? So you want to do your best in using short exposure times to minimize any type of motion. Are you guys using your photocells in the hospitals, or are you guys doing manual techniques?
Oh, photocells.
What's that? You're using photocells? Are all of you guys using photocells?
Only in one room.
Only in one room? Okay. How about Whittier? Are you guys doing photocells there, or are you doing manual?
Like I said,
both?
Just the one room has the photocells.
Oh,
Everything
okay.
else is manual.
All right. All right, so
if
you are doing photocells, then because of the skull, which one do you think is going to be
center cell
appropriate? The center cell, because the ones on the side you're not going to be hitting anything; you'll be skimming the bone. So center cell is going to be appropriate. Thyroid and breast shields, because we're shooting the head. Take into consideration of using thyroid and also breast shields for the females. I said consider. Is that what you guys are doing out there? Are you shielding the thyroid?
No, the breast.
Oh, the breast. You are shielding the breast. Okay, okay, good. All right. So not everybody does that, and when you do something like that, they look at you like, why are you doing that? But we know why, right? Shooting the face. Thyroid is close. It's a blood-forming organ, and the breast is sensitive to radiation. What else is sensitive to radiation?
Eyes.
Eyes. Do we shield the eyes?
Put two lead coins right there.
Yeah, right. All right, so short exposure times, patient comfort will also aid in reducing motion when using short exposure times, and also clean hygiene, which means that, look, their face is going to be all over the table and on the wall unit, so clean it up before they put it up on there, and also clean it up after, okay? 5 common positioning errors includes rotation and tilt. Rotation and tilt. So rotation is you have a center axis. So it's a break in the center axis. Okay? Tilt is a break in your mid-sagittal axis. So that's the difference between rotation and tilt. One is your pivotal point, so a center axis. The other one is a break in your mid-sagittal point. Mid-sagittal plane, I should say. Okay, so those are the most common mistakes. Next one here is also excessive flexion of the head and excessive extension of the head, as well as incorrect central ray angulation. So how do you fix those errors? Okay, you can do it like this. So if you have a hyperstenic patient, you're going to have broad shoulders. What's naturally going to happen is the head is going to want to, is this tilt or rotation?
Tilt.
This is a tilt, okay? So with hyperstenic patients with broader shoulders and they place their head down on the image receptor or the table, it's going to cause a tilt. So to correct for that, we're going to lift up the head with some kind of bolster until the mid-sagittal plane is parallel with the image receptor, and the intrapupillary lines are perpendicular with the image receptor. Okay, so there's two things here that you're trying to align, is your mid-sagittal plane, which is parallel, and your interpupillaris, which is going to be perpendicular. Okay, here it's not parallel, here it's not perpendicular. And then you have somebody here who is hypostenic. So now the tilt is the other way. So now instead of tilting the head, we're going to raise their chest up a little bit. So now we get mid-sagittal plane that's parallel, interpupillary that is perpendicular. Common positioning errors.
Casso or what?
Okay. We're not symmetrical on both sides. Well, I know. I mean, but here, look at this guy. Does his face look like it's symmetrical on both sides? No, it's different. Have you guys ever done that where you went on the edge of the mirror? Okay, and you're trying to see what you look like if you had this same face, this face on the other side.
That's my good side, that's my bad side.
Have you guys never done that? Is that only me?
That's a you thing.
Yeah, I do that. I do that to see what I look like if my face looked like that on the other side, and I look like a completely different person. Seriously, you should try that. Of course, have a couple of drinks first.
Of course.
All right. So this is the most common positional errors. Is because our face is asymmetrical. Okay. Asymmetrical.
Ooh, she's ugly.
I know, right? All right. Patient prep.
Hair ornaments.
We're dealing with the skull. So, hair ornaments. Pins, ribbons, clips.
This is like, these are done during the holidays, alright?
Glitter,
These are Christmas x-rays.
all that different stuff. Okay, earrings, glasses. So get rid of any artifacts. You guys are getting used to already asking your patient to remove any type of jewelry, body jewelry, right?
Mm-hmm.
Same thing here. You have them remove the jewelry.
Get rid of your
and
ornaments.
if they can't, you got to do your very best to get rid of that. And if you can't, you need to note that on your requisition and tell your doctor.
That was a good shot. It's right in the middle of the bottom shelf.
Right here?
Yep, all
Okay.
the way in there.
I got another
Good
one.
luck.
I'm ready. I'm prepared. I got another one. Okay. Pathologic indications for doing skull study. Number one is skull fractures. Number two is gunshot wounds. Number three is some type of cancer or neoplasms. You have osteolytic, which is destructive disease. Osteoblastic, which is overproduction of bone. Multiple myelomas, pituitary adenomas, and also Paget's disease. Of course, there's a few more here, but this is just your basic pathologic indications of why you do skull studies. Okay, any questions?
No.
Okay, second set of slides.
Really?
Yeah.
Yeah.
Yeah. It's only,
They're smaller.
yeah, there's like 20 of them. You guys want to take a quick break?
No.
Okay, so take your break as I'm speaking then. I won't be offended.